The most common elbow ailment that I see is typically tennis elbow or lateral epicondylitis, which is an inflammation of the tendons on the outside of the elbow. It's a common thing to have. You don't have to play tennis to get it. It happens a lot with other racket sports, golfers, anybody that uses their upper extremities for a significant amount of activity. Commonly, it's self-limited, meaning it gets better if we did absolutely nothing. We like to try to help decrease the discomfort, whether that's through braces or physical therapy, injections. There is also a couple of procedures that can be done, typically in the operating room, that are small but are operations that have had good results. And typically those patients have not responded to other types of treatment without surgery, and that's when we consider doing those kind of procedures.